Hello, and welcome to an unusual, actual cutting edge pain relief talk that is a live stream on Wednesday instead of our typical Thursday. Today, we're talking about transcranial magnetic stimulation again, much like last week, but this week we're talking about how it can help with pain. I got so many questions about the off label use about pain and how to be able to treat it specifically, not through the mechanism of us being able to treat it via depression, that I figured it was warranted for me to do a different talk. So, this is what's going to take place today instead of our traditional Thursday talk. So, we're going to talk a little bit about transcranial magnetic stimulation. What does it mean? And how it can be able to help you with different types of pain and why it's important. So, full disclosure, normally I try to stay within the elements of the topic that we're talking about and um, really make sure that it's pertinent and really focused for the viewer. But bear with me for a second while I kind of make a quick divergence. So, one of the reasons why we decided to bring this into our treatment options and utilizations for therapy is one, I understand patients that have had issues with depression because I've had some of those same issues myself. Two is I've had a personal issue. The reason why I got into medicine is my dad had a stroke. And as many people may not know, is that sometimes patients that have strokes have pain that's associated with it. And their pain is number one, hard to diagnose, um, sometimes because of the issues with it, which they might have with speech and being able to actually localize where they feel the pain. But more importantly, or rather, just as important, is that it's very difficult to treat. Traditionally, it's not because of a muscle or a tendon, or even sometimes that aspect of a peripheral nerve, but more so, it has to do with the central element, meaning the spinal cord, possibly, or the brain. And being able to treat that type of pain is much more difficult to really be able to provide relief. And that's one of the reasons why we've decided to bring transcranial magnetic stimulation into our practice and also hopefully can be able to educate patients and individuals about why this might be of benefit to them. So, one of the papers that we selected in terms of being able to help for this, and we'll kind of pop it up on the screen a couple different times so you can be able to see it and write it down and see it for yourself, is the following is effect of repetitive transcranial magnetic stimulation on pain management, a systemic narrative review, right? And so when we take a look at this paper, you're going to get an idea about what exactly does that mean, what does it entail, and really how is that um, going to be useful for someone who has pain as opposed to someone who just has a traditional mood disorder. And when we talk about pain, we're going to talk about a whole host of and source of issues for that type of understanding. So as we click to the portion of explanation is that they found that RTMS, and R stands for repetitive, TMS was beneficial for specific types of pain, but in particular, neuropathic pain of a lot of different origins, central pain, which we're going to talk about and explain what that means, pain for peripheral nerve disorders, fibromyalgia, and migraine. And when we get into the understanding about how they selected what papers and how to be able to assess this, it was a pretty robust analysis of the different papers and how they reviewed it to be able to narrow it down. And then we're going to talk about what these different treatments or pain conditions are and how that might be useful to you or someone you care about. So you may not be able to see this in its entirety, but what it basically says is that there is TMS is transcranial magnetic stim. It's a safe, non-invasive technique that basically uses an electromagnetic coil to generate a magnetic field. And how the patient particularly perceives this is normally kind of a more of a painless sort of um, pulse, more so than anything else. And these pulses actually can change the excitability of different cells within the brain. And so that sensation probably is pretty similar to how you might have an MRI, and you'd have that magnetic component that's focused in that area. And for those of you who are joining live, like Elaine, thank you so much. Again, we're talking about transcranial magnetic stim within the context of how to be able to treat for pain, not just for mood, although you could, in theory, be able to do both of those two different issues. But as we increase the excitability of those different nerves that are present in the brain through the pulses, it's shown some improvement by affecting both motor, meaning movement, right, as well as cognitive functions, and being able to reduce different symptoms and disorders like stroke, Parkinson's, and major depressive disorder. But what we really wanted to kind of lean into was the element of pain. So what this actual paper did is it was a paper, rather, it was an assessment of papers that took place over a period of time up to and including June 2019. And what was assessed was 1,300 papers for a number of different criteria. But basically, the primary ones were number one, did the patients have pain? Number two, was there repetitive transcranial magnetic stimulation that was applied in order to be able to address their pain specifically? Were there follow-up evaluations that were robust to be able to assess how long the pain relief lasted for? And so of those 1,030 studies that they looked at, they found about 106 publications. So it was a really narrowed down dynamic, about maybe in essence about 1 out of 10, but still 106 papers talking about transcranial magnetic stimulation for dealing with pain is quite a bit. And I think many people would believe that TMS has only been utilized more for mood and anxiety and other things along those lines, but that's not necessarily the case. Right now, it's not an FDA indication, so it hasn't been approved, meaning insurance is not going to cover it specifically out of pocket. But there's a lot of value in substantive studies that have shown how this might. So the first thing that we're going to talk about is the following. We kind of get into this after the introduction. Talk about neuropathic pain. So first, what is neuropathic pain? So neuropathic pain is pain that's derived from a nerve. Traditionally, that nerve is going to be more peripheral in nature. It can have a whole host of different reasons for why it actually is causing a problem and an issue. But typically, it's experienced by the patient as burning sensation, a tingling sensation. It can be shooting. It can be classic sciatica. The other names for it are radiculopathy. And you can traditionally see it more than likely within the aspect of the digits in the limbs, right? However, it doesn't always have to be that way. It could be potentially something like postherpetic neuralgia, where you have a nerve traditionally within the areas of the intercostal nerves that sit underneath the elements of the rib that can have an issue or problem that's associated with it as well. The normal mainstays for nerve pain type treatments are going to be conservative. So we do things like a topical, like a lidocaine type patch, or if it's warranted and it's indicated, something like a capsaicin type patch or a topical system, if you would. It could be treated with oral medications. So those are going to be things like gabapentin, also known as Neurontin, Lyrica, pregabalin, Topamax, amitriptyline, Elavil, duloxetine, Cymbalta. So the different medications that are normally quote unquote nerve pain type medicines with both their standard and their brand name. The problem is most of those medicines don't work all that great, one. Two is that they frequently have a number of side effects that are associated with them, from everything from sleepiness to dizziness to dry mouth. And sometimes those side effects are just significant enough that it's really hard to be able to continue taking that pill. So if you can be able to get treatment for something like neuropathic pain by being able to have a system that is non-invasive, that doesn't require for you to have any type of surgical intervention, side effects from medications, it's a pretty huge sell in order to, not even a sell, but a huge benefit to be able to get that type of relief. And so when they took a look at neuropathic pain, one of the things that they found is that it was a really great response. They had a number of different papers that looked at multiple different center trials. And at the end of the day, what they were able to see, I want to say across about 16 different studies, specifically looking at neuropathic pain, is that that degree of benefit was greater than placebo by a fair amount. And the length of time of relief was prominent, and all of this was able to be reproducible over multiple different sessions. So that's the context of neuropathic pain. We talk about Central pain. Central pain is what I alluded to earlier. So it's pain that's coming from a more central source. Traditionally, it's going to be more from the brain than anything else. And it's associated with also that burning sensation. Sometimes you have the components of allodynia, where you have a light touch causes some degree of pain when it normally wouldn't. And about 30% of patients have had some form of brain or spinal cord injury that has really caused this type of issue because of a lesion that's occurring within the aspect of the pathway. When they took a look at this type of pain, they were able to see that there was a fair amount of benefit. So we're talking about pain that historically has been incredibly difficult to treat. So central pain, because of where its localization happens to be, it is difficult to really get high doses of any of those medicines like Neurontin, Lyrica, Cymbalta, Elavil. Very difficult to be able to get the dose that's going to be significant and give you a response. There are other different types of therapies that have been tried, but most of the time you don't get the same degree of benefit as what you do by using something like this. So central pain after stroke, which is what I alluded to earlier. And so when we talk about that, we're talking about ways to really be able to kind of treat the areas of the brain and be able to treat them with a significant improvement of things like allodynia and hyperalgesia. So allodynia being pain that you normally wouldn't feel. Now you can feel it all of a sudden as pain from, a non-painful stimuli, to things like hyperalgesia, where if you had a small pinch, you would feel a little bit of pain, but that pinch wouldn't be like you had the whole area of your hand just sloughed off or chopped off with a knife. Those are things that you can feel when you have pain that's of a central source, particularly post-stroke. And so what we wanted to be able to do was to really kind of lean into where we're able to see some degree of benefit. And for this, they had 11 studies with 3 randomized controlled trials on this review, and they were to see a fairly significant benefit that was present across the multiple different studies that made a really impressive impact on people trying to be able to get some help. So the next is central pain after SCI, and SCI stands for spinal cord injury. So that spinal cord injury that occurs in patients traditionally produces some type of pain in about 5 years after the injury, between the 0 time frame to 5 years, let me be clear, in about 60% of individuals. So if you have pain that hasn't immediately resulted, it can result at a later date. And traditionally, it is from the injury, from a spinal cord injury. And this also has been a very difficult to treat mechanisms because it is of a similar central nature. But TMS has been able to show that there's benefit to performing it within the areas of problems with spinal cord injury. So then we have fibromyalgia, which historically has been a pain treatment diagnosis that has been excluded. It's been ignored. It's been pushed to the side and said, well, it's a myofascial issue. It's not something that really is going to be able to be responsive to a neuropathic pain type treatment option. So at the end of the day, what can we really be able to do about this other than meds? And what has been shown within the areas of TMS is that there are things that can be done about fibromyalgia. Interesting enough, for those of you who are watching this at a later date, one of the things that we're looking to do is to be able to get one of the most famous TMS practitioner physicians on board. And talking to her previously, she was able to delineate how she's able to help both depression and fibromyalgia in her clinic that's present in the state of Washington, and how it's really not only impacted the patient's life, but it's also impacted her life as well because of the degree of benefit that she can bring. And then of the different conditions that respond, and we can be able to show true documentation within the context of those 100 some odd studies, is headache. And when they looked at and reviewed the headache literature, they could see that it was robust, it was prominent in a lot of different areas and regions. But at the end of the day, they were able to identify 18 studies, 8 of which that had randomized controlled trials, and were able to compare and contrast and see that there was benefit that's present within the utilization of TMS versus traditional treatments for headache. And then finally is oral facial pain. So when people think about oral facial pain, they're kind of like, I don't understand. Is it maybe the mouth? Is it something like this? So oral facial pain could be different things like you having a problem with the facial nerve, the trigeminal nerve that can give you issues and problems. For you to have an overall cervicalgia that could be giving you an issue, TMJ, that's a possibility. So those type of um, issues that present within the context of the face are falling under oral facial pain. It also has been able to get good responses from TMS. And so now we start getting into those that haven't had the same studies to be able to verify them. And then are things like phantom limb. So phantom limb is a pain that occurs after a limb is severed or amputated, and that previously existing area is perceived as being there and being painful with the hotness, with the burning. And the traditional way of trying to be able to treat it is within using using nerve pain medicines like gabapentin or things like Lyrica as a treatment option. And most of the time, they don't do what we're hoping to be able to do. Because there weren't enough studies to really be able to validate the utilization of TMS and oral facial pain, it's something that could be tried, but I think that the literature is still out on being able to really identify, is oral facial pain a potential treatment for, rather, is oral facial pain a potential indicator and treatment option for something like TMS. Then finally, low back pain. We've been waiting for this for a while, right? Well, if you have a back issue and I got multiple different discs, is it possible that by treating, this TMS treatment, that maybe we end up getting benefit from it as opposed to needle injections, invasive implants, all those type of things are things that I think would be huge. So when we start to assess and say, okay, can we be able to help low back pain? Can we be able to provide some benefit? What are the different ways that we can be able to interpret how low back pain can be treated by using a non-invasive therapy that, again, has indications for approval in certain realms, i.e., just kind of refreshing memory. It's FDA cleared since 2008. It's a non-drug treatment option. It's non-invasive. There aren't any side effects like there would be from drugs. It's not ECT, meaning it's not electroconvulsive therapy where you have a shock that's given to you and that's what you feel and perceive. In addition, it is long lasting, like I said, for about 2/3 to almost 3/4 of people. It's covered by most insurances, and there's been over 3.5 million treatments that have been delivered. So that's kind of the reiteration of what do you get when you talk about doing a TMS type treatment, and is it validated? I think it depends on the condition that we're trying to treat in order to be able to get benefit. But as we're going through these different pain states, what we can see is anecdotally and via the research, there's value into being able to have TMS for pain. Some of the other things we're going to kind of gloss over a little bit quickly are the following: myofascial pain syndrome, pelvic pain, and then complex regional pain syndrome. So when we talk about these three different ones, myofascial, pelvic, and complex regional pain syndrome, they all respond differently. And the articles pretty much saw that, so that even though we would like to be able to make an extrapolation and say, you know what, it can be able to help across the board for multiple different pain results, I think it's really dependent and cogent upon us to make a decision about using the right tool when it's needed to be used. So in this little blurb, it basically says repetitive transcranial magnetic stim has been used to treat other painful conditions, including post-herpetic neuralgia, brachial plexus injury, post-surgical pain, visceral pain, somatosensory pain, and knee osteoarthritis. So quite the list. And from a regenerative medicine standpoint, sometimes we're talking about being able to do a hydrodissection to try to be able to free up the nerve that's potentially entrapped. And that still, I think, is a pretty darn good idea to do if patients have the means to be able to do something like that. But if they don't, and they're looking for an insurance coverage that is unique and different, this might be a treatment option for you. The major downside is the following, is that it's a lengthy duration of treatment, about a month's worth or so, most days, but you're not getting stuck. You're only kind of getting into an area that feels like MRI, but completely is different. Your mouth is out, your hand is out, your face is out for the most part. You can be able to see and talk to people. So it's not quite like getting an MRI, but it's in that vein in terms of the type of technology that's working. So our next paper that we took a look at, our next two papers, as a matter of fact, which we'll summarize, was the following. The paper was found in Clinical Neurophysiology, which basically reads the evidence-based guidelines on the therapeutic use of repetitive medicine. Of repetitive transcranial magnetic stim from 2014 to 2018. And then the non-invasive transcranial magnetic stimulation, TMS, in chronic refractory review, systematic review. So all these studies are basically doing was to really be able to say, all right, do we have patients that have been made to feel better consistently, better than what we think they otherwise would have? And I think that that's plausible. Even though we've had some patients stop their medicines and do different chores like this, it hasn't given them as much challenge or difficulty as what they originally thought. So what I would say to you is, if you haven't talked to a provider about TMS, it's something to consider, assuming that you have pain or assuming that you have mood disorders. We'd love to talk to you and see how we can be able to help you. If you're local to us, please give us a ring, a shout out, and let us know. Thank you.